Hello, my name's Corey. This is my video assignment for Nursing 730 on the anxiety disorder section. And our scenario involved a woman, a 32-year-old woman named Mary, who came in with anxiety disorders, or symptoms of general anxiety disorder. So I'm going to talk briefly about what that is and discuss the medication that I would prescribe for her, and then I'll get into the section scenario about prescribing benzos and how I would go about doing that. So what an anxiety disorder is it's involves excessive fear, worry, or extra vigilance about anticipating something terrible might happen. It's persistent and oftentimes disabling. These symptoms can manifest as generalized anxiety, panic attacks, social anxiety, or manifest in specific phobias. The causes are multi-layered. It can include genetics, brain chemistry, the environment, environmental stresses, and just general life stressors. Symptoms can include restlessness, difficulty concentrating, muscle tension, sleep disturbances, and avoidance behaviors. They're typically diagnosed on the duration, the impact on daily functioning, and the exclusion of any other medical cause or condition or substance-related causes. So I decided to prescribe for Mary Buspar or Busporin. It's a medication that's in the anxiolytic category. It is for treating anxiety. It works differently, however, from benzodiazepines or antidepressants, which I liked. It's actually a partial agonist at the serotonin receptors, the 5-HT1A receptors, which help reduce anxiety symptoms over time, so it's more of a long-term treatment. It's not a sedative, and it does not produce immediate calming effects like benzos would. So it's used primarily for generalized anxiety disorder and is sometimes used for other anxiety-related conditions, and it can be part of a long-term management plan rather than for acute anxiety episodes. So on Buspar, the benefits typically develop over several weeks of regular use. It is taken orally, and since it does not have side effects that are sedative or dependence, there aren't really dependence issues on it. It does have side effects such as dizziness, nausea, or headaches in some people. So definitely Mary will need to be monitored regularly by her healthcare provider. Let's see. So as far as Mary coming in and seeing her healthcare provider and requesting to have benzodiazepines to help with her acute anxiety, let me find it here, sorry about that. Usually, and I agree with this, based on evidence, usually benzos are reserved for very acute short-term anxiety and panic symptoms. So if she was having these panic episodes, I do think that benzodiazepines would be helpful. It's certainly not a long-term solution because they are very addicting. And so if she's being triggered by a crisis, benzos are not usually the first line to sustain generalized anxiety, but they do have a positive effect on panic and anxiety episodes. So there are risks. Not only is there a risk of the dependence, but also becoming more tolerant. There might be withdrawal symptoms if Mary were to stop them abruptly. There are cognitive effects, and there are potential interactions with benzos. So also, benzos can be very sedating, cause dizziness and impaired coordination. So they can be used short term as needed with a clear plan of how to taper them off. Hopefully with the boost bar, that would start to take effect and she wouldn't need the benzos for these short-term episodes. So definitely educating the patient on that, and closely monitoring would be very important. Let's see. I also think that along with the benzos and the boost bar, that she'll need therapeutic counseling, and that could be with CBT therapy. The therapy could focus on coaching for work-related stress, social anxieties, things like that. So there can definitely be a combination to treat Mary and help her get the support that she needs. And then coming up with a really concrete plan for monitoring, keeping track of when her anxiety symptoms start and what might have precipitated to trigger, keeping a sleep diary, and definitely a timeline for when she can be reassessed. So getting into reflecting about personal beliefs, I'm always going back to the fact that it's a neurobiological disorder that's happening for people that have mental health disorders who struggle in that way, and especially in this instance with Mary, it's when you understand that it's a neurobiological condition that's happening, that definitely shapes my empathy for the person, understanding that the biological factors that are happening contribute to the anxiety, and so I need to just be extra compassionate, supportive, listen in more attentively, and really involve Mary and her family if she wants them to be making choices that are right and aligned with Mary. And so my feelings about the risks and side effects, I probably have some opinions about that. However, this awareness of the pros and cons can definitely form a bias. So I need to be very aware that that I have a bias. Which would be, I am really cautious about benzodiazepine, especially just straight on their own with obviously a prescription that's has a ton of refills and there's no plan in place. I do think they help in acute, immediate situations, but I'm not a big fan of prescribing them, more as a last resort while we can get other things in place, which would be the more long-term solutions. These can include not just anxiolytics, but antidepressants and therapy and coping mechanisms and just support. So I don't want my biases to get in the way. However, it's also my responsibility as a prescriber and a healthcare provider to make sure that we are doing what's safe and healthy for the patient. So I would prescribe the benzos on a very short-term basis. So that's really what I have as far as reflecting. I think I hit everything I was supposed to in the scenario. And yeah, that's all I have. So thank you so much, and I will see you next time. Okay, bye-bye.